I'm grateful that you could make time to join us. On Friday, we told you the story of patients who needed laboratory services at their Konfanochi Teaching Hospital, saying they are forced to spend more on services provided by private facilities due to the sit-down strike by the hospital's laboratory scientists. The patients were worried the already high cost of treatment at the hospital could rise further if the strike does not end soon. The laboratory scientists started their strike over what they say is the imposition of a medical doctor or doctors to superintend their activities. The Health Service Union workers backed the strike, but was worried it could escalate into a nationwide issue if not resolved. While the Ghana Association of Medical Scientists, JoyNews learned, met with other allied health professionals in an attempt to rally support for what could be an escalation of its industrial action should it fail in its quest to have management of CATH accede to its demands. Today on News Desk, we are moving the conversation forward. Now, the Society of Laboratory Physicians Ghana is a body of pathologists, hematologists, microbiologists, clinical chemists, and histopathologists. Some of their members seem to be in the middle of this raging issue. So joining me on Zoom this morning is Dr. Kafi Akakpo. He is an anatomic pathologist at the Cape Coast Teaching Hospital, and he heads that particular society that I'm talking about. Grateful that you could join us. We've also been joined by Dr. Abudu Rahmani, who is the head of the Ghana Association of Medical Laboratory Scientists. Thank you, gentlemen, for your time. Let me come to you, Dr. Akakpo, because we haven't really heard from your society, which these two hematologists at the center of the Konfanochi Teaching Hospital issue are a part of. What exactly are your concerns with regards to this particular issue?
Thank you for having me. Our major concern about this issue is that there is an attempt by a group of people working in a hospital laboratory to annex the entire laboratory to themselves, which we think it's uncalled for and unnecessary.
Okay, but I think that this issue, if I'm right, and Dr. Abudu can correct me, has to do with who heads the laboratory and not per se who can work there. Dr. Abudu, am I right?
Yes, you're absolutely right.
So, Dr. Akakpo, why should this be a problem? The laboratory scientists say this is our field. Yes, some of your doctors or physicians may have specialized in it, but this is our field and we want to head it. Should that be a problem?
So it goes beyond the issue of just headship. The two hematologists in question do not head anything in Konfanochi Teaching Hospital. They are just working as hematologists. So the issue is not just that they just are discussing direct fashion. In that case, then this issue, this strike shouldn't even happen in the first place, because those two specialists are working as hematologists in the hospital and are not head of anything. Now to the issue of headship. The laboratory in PAS is managed by a laboratory scientist. There's nothing wrong.
Unfortunately, Dr. Akakpo, as you can hear me, we've lost you there. There appears to be a challenge with your line. I'll be glad if you could reposition and so that we could hear your concerns clearly. But while you work on that, let me bring Dr. Ramani in here. Doc, so he's made a very categorical statement, which is that this has got nothing to do with who heads Konfanochi's laboratory. What will your response be to that?
Thank you very much for having me, Benis. It is not about they being the heads or not being the head at the moment. Benis, if you are going into an institution, you go in and looking at the objective of that particular institution and the objective for which you are going for that particular training. When you take the curriculum of the laboratory physician, their objective is very clear. Is that they are going to be laboratory managers across the country, from health centers district hospitals, regional hospitals, teaching hospitals, that the laboratory is their territory and that they have to be the head of the place. So for now, they may have come in not to head, but what is the end game? What is the agenda? And that is the reason why when Confanochi publicized the addition requirement, like requesting people to they advertise a position for hematologists, requesting more doctors to come in, then it's clear to us that the agenda is very clear. And we keep on saying that each of us have our own territories. We have our acts which regulate all of us. You take Section 1, Allied Health Professional Council, Section 2, Medical and Dental Council. Each one of us has a territory. So I cannot just stand up and go into a consulting room. I cannot just stand up and go into a gynecologist office and say that because I've done something around gynecology, I have a space here and I should be allowed to work in that particular space and even possibly be the head of that particular space.
Hello, Doc.
They always try to hide behind one thing or the other. The main agenda is very clear. Objective for setting up here. Hello.
Yeah, sorry, we lost you there a bit. Hi, Doc. I can hear you now. We can hear you.
Hello, I'm online.
Yes, please, you are. We can hear you. Can you hear me, Doc?
Yes.
Yeah, please proceed. Too bad. It appears we've lost Doc as well. We were just hearing from him. Well, I hear Dr. Abudu Ramani is back. So, Doc, with all that you've said, I get a sense that this action is preemptive. So you are preempting a move that has not yet happened. And should patients be suffering because of something you foresee which hasn't yet happened?
It's not that it has not yet happened. Ask yourself what is happening at Caicos. What were they pushing at TTH? What were they trying to push at home? It is not something that has not yet happened. It is just that because of the resistance and resilience of the medical laboratory scientists at Kolebu and then Confanochi, that's the reason why we are here. Because if they had not resisted it, this would have been the next stage of the action. Go to Cape Coast and ask what is happening there. Go to Ho and ask them what is happening there. So it is something that we think that the ministry has to come in and sort it out once and for all. For us, the patients are our people, our clients, and we want to serve them. And so that's why we keep on calling on the ministry. The 3 weeks they have given is too long. What at all are we waiting for in the next 3 weeks when we know the issue? Okay, so why can't we meet? Why can't stakeholders meet and then draw out what needs to be done so that the patient can have their peace? And secondly, we said that, look, an issue on the table. Can these medical officers posted to the hematology department reassign? They have a pathology unit. Can't they be moved to the pathology unit for now? Because they are pathologists and they have a pathology unit. So why necessarily have to be in the hematology unit? It's a simple thing. So for now, get them to the pathology unit. Let's sit together. Let's sort the issue out. If after all we all agree that they have to come back to the hematology unit, why not? Because it will be a decision, it will be a collective decision which all of us will take. But for now, please move them to the pathology unit.
Doc,
since there is a clear unit for pathology, move them there whilst we sort the issue out.
Okay, Doc, you are at is the strike at Confanochi ongoing, and has it escalated as we were told it would?
Confanochi, the strike is ongoing. The sit-down strike is ongoing. They are hoping that they will get a response from management as to the reassignment of the 2 medical officers until the issue is sorted out. That is the demand, a simple demand which is being requested for. Just reassign them to the pathology unit. When we solve the issue, if they have to come back, they come back. After Wednesday, based on the feedback we had with our national executive chairman, the point here is that because of the knowledge at stake now, that the agenda is very clear. our members in the Ghana Health Service, being at the regional and the district hospitals, are also highly not comfortable. And they say that they don't want this thing to be reoccurring day in and day out. We've spoken with them, we've pleaded with them to hold up the peace. But they said, well, they are going down to speak to their people. Whatever the outcome is, they will let the nation know. For us as executives, we will do our best to continue speaking to the ministry to hasten faster and ensure that we don't get to the stage where there will be a clear lay-down strike across the country, which I can tell you that from the action of our members yesterday is something that if nothing happens within the next few days from Thursday, anything can happen.
So as it stands now, just for clarity, CAF is the only hospital where laboratory scientists are embarking on the strike?
Yes.
Okay. Thankfully, we've been able to raise... Sure.
But then from Thursday...
Sure. Thankfully, we've been able to get...
from Thursday...
All right, thankfully we've been able to raise Dr. Akakpo back on the line. He heads that Society of Laboratory Physician Scientists here in Ghana. Thank you so much for joining the program again. Now, we've been listening to Dr. Rahmani say a couple of things, including why not send these hematologists to the pathology department while we resolve this issue. He sees a clear attempt nationwide to have laboratory physicians take over laboratories, and they're not excited by that. Why should this be difficult for your colleagues in Komfo to do?
Okay, thank you very much. The use of the word pathologist, I am sure he's referring to anatomic pathologists, which I am. Okay. Now, when the word pathologist is used, there are many other people involved. There are hematologists, clinical chemists, there are microbiologists, and then there's anatomic pathology, my discipline. We do the autopsies, we do the histopathologies, we report the cases that people bring to us, breast biopsies and core cancers and all that. The hematologists in question, these two women, are actually treating people who have cancers that involve the blood, okay, lymphomas, that are lymph nodes, and then treating people with sickle cell disease and dealing with transfusions. They have no real place in histopathology where we do autopsies because that's not their subspecialty in laboratory medicine, okay? So he's making it simplistic to make it look like these people belong to anatomic pathology. Yes, they are pathologists, but they are hematologists, okay? So the umbrella of laboratory physicians has other subgroupings that need to be taken note of when somebody makes a statement like that, okay? And then the Department of Hematology, where they are, has a laboratory. And in addition to that, it has a clinical arm, which includes a consulting room and many other things. So it is very simplistic for him to think that you should just send them over to, let's say, anatomic pathology and let them sit there. No. Of course, they don't have an office even in the laboratory that they are talking about where they work. The hematologists do not have an office in their lab because they've never allowed them to go into that laboratory space. The space has been cordoned off and only laboratory scientists can enter there. And I tell him he can come to the consulting room at any time if he has a business there. No doctor owns the consulting room. So the problem is we don't understand how a group of people say that a place in the hospital, which is a public space, is a no-go area for a certain group of people because they think that they are going to take over the place. We have never managed laboratories. Laboratory science has been around for a period that we are all aware of. When I entered medical school in 1995, that is when the current medical laboratory science program started. Before then, there were certificate programs. These were run by medical laboratory physicians, okay? So we are not saying that we want that space. We don't want to manage the space because the space is managed by laboratory scientists and they are capable of managing that laboratory science space. However, laboratories are under, that laboratory is part of the hematology department. And the hematologist who heads that department should feel free to work in that lab space. He works with the people. They are his colleagues. So she should be able to go there and work. And that's our problem. When they say that that space is a space that the laboratory physician or the hematologist should not come to.
Doc, he mentions... Doc, he mentions your hospital, that's the Cape Coast Hospital, yes, and the Tamale Teaching Hospital as examples, yes, of hospitals that where lab scientists didn't complain about the situation and they eventually had some sort of management by laboratory physicians. Can you confirm if in the Cape Coast Teaching Hospital there's a laboratory physician who heads the department?
Okay, so the Department of Hematology, okay, in Cape Coast Teaching Hospital has a clinical arm which is run by Professor Ivy Ekem, the past dean of the medical school, okay? So they run their clinic and then they run their sickle cell patients clinics in there. And in addition to that, they work with the hematology lab, which falls under, in Cape Coast, what they call the general laboratory system. So there's a general lab manager, who is actually a medical laboratory scientist. Yes, the person is not a laboratory physician, but the Department of Hematology, yes, is headed by a laboratory physician. But the lab manager is a medical laboratory scientist, and that works well. I am the Department of Pathology. The Department of Pathology in Cape Coast Teaching Hospital has an arm that teaches in the medical school, has an arm that does autopsies and goes to court, does exhumations, and it has an arm that also goes into histopathology. And these are things that primarily are not done by medical laboratory scientists, but by pathologists like me. So that department is headed by Dr. Dechi Kwatin, who is a pathologist, okay? So the part of that lab, which is headed by a laboratory scientist, if you are in Kolebu as an example, is the histotechnology and histoscience. That is also a very advanced area of this discipline. Without them, the whole discipline will not be able to continue. So yes, we work together, but I can walk into the laboratory space in Kolebu where the slides are prepared and where STAN and other important things that facilitate the work, my work, are done. And that's okay. And in fact, the head of that laboratory can also come to the office and also discuss issues. We work together. So I don't see where this headship issue is going. And the other thing is that this stretches even beyond just the kind of place where, like making it general, different laboratories have different purposes. Okay? A teaching hospital laboratory usually has all the components that I have mentioned as compared to a non-teaching hospital laboratory. Regional hospital laboratories have a different setup. District hospital laboratories have a different setup, okay? So making generalizations makes it difficult for us to deal with this subject because we are not going to be at all the places. We have different levels and the regulations should allow all those in the laboratory space to work there. As an example, it's not only the pathologist who works in the laboratory. No, there are some geneticists in there. There are many other types of biochemists who have interest in medicals. The researchers like Noguchi Memorial Institute, they do medical research. One group saying that that space belongs to them and the others should not come in because they think that we are going to start heading the place. That is an untenable argument.
All right, Doc, I appreciate your time this morning. Dr. Kafu Yakapo is an anatomic pathologist at the Cape Coast Teaching Hospital. Let me wrap up with you to Dr. Ramani, who is the president of the Ghana Association of Medical Laboratory Scientists. So you heard him there. He says your argument just simplifies the issue. It's bigger than that. This is supposed to be a group of people who must work together with laboratory physicians. But I'm just wondering, prior to this whole issue of the suspicion that laboratory physicians were going to head the department, how are you working together with them? Hello, Dr. Ramani, if you can unmute so we hear what you're saying.
Okay, thank you very much. Like I just said, every party will try as much as possible to make things simple to suit his or her argument. In this particular case, he tries also to make things very simple. The question is, if they are at the clinic of Confanochi, then why is it difficult to move them from the hematology unit? The hematology unit is the technical area. And the technical area, per the regulations and per the law, is supposed to be run by a particular group of professionals.
Okay.
So I ask a question. Even though a gynecologist and a neurosurgeon are all medical officers, can a gynecologist go and supervise a neurosurgeon?
Dr. Abudu, Dr. Ramani, we've heard you say that. My question is that prior to this suspicion that they are being brought in to come and manage laboratories, I want to believe that there were hematologists, there were laboratory physicians who you were working with. How were you collaborating? How was the work done? Were they allowed in the labs at all to come and do their work?
We have been collaborating for as long as I remember. And all the people he mentioned, we have worked, and some of them they have even taught one way or the other. As it is a system where we interact with each other. We've been working with each other. But the point here is that we were having our own territory where our people were handling the situation. Okay, we had laboratory physicians who were with us and they were working along with us. This question of who hurts who was never so much of a problem because we understood each other and we worked together. But when it becomes clear that they have to merge a system, so you have a clinic and then you have a laboratory. The laboratory is not inside the clinic. The laboratory is a public space. Okay, which is regulated and run by another group of professionals. So certainly, a medical officer who has specialized in his field is expected to man her clinic or his or her clinic. And the laboratory scientist who has also specialized in his area is expected to also manage his territory. This is the simple thing we are asking. So do not try and say that because you are the head of the hematology clinic, automatically you are the head of the technical area too. That is not what we expect of them. Previously, that was not what was happening. This
is more of like a turf war. If I may, just for purposes of education and understanding. So we've been told like a hematologist will do their basic, bachelor, which makes them a medical doctor, and then they'll go ahead to specialize in hematology. Between somebody who's done that and a laboratory scientist, who is more advanced? Because you just mentioned that sometimes they teach you. We just want to understand in terms of the medical system and profession, who is more advanced?
Yes, so let's make it this way. The highest person there is a consultant. Okay, the highest person there is a consultant. So we equally have consultants who also are teaching medical doctors as we speak now. And they equally have consultants who are also teaching medical laboratory scientists. So it's a crisscross affair. And the highest person who is supposed to teach over there is the consultant. So you have a medical officer who has become a consultant. So why would the medical officer who has become a consultant say that he is the rightful person to head even the consultant in the medical laboratory science?
Right.
That is the basic question. Because you are a consultant, I'm equally a consultant. So why would you move from your medical site and come and head me in my technical area? That's the whole argument. Right. If you have a consultant, we said, let your consultant manage the clinic and let our consultant manage the technical work.
Right. Dr. Abudu Rahmani is president of the Ghana Association of Medical Laboratory Scientists. I'm told we have Dr. Akapo still on doc. Just 1 minute for you to react to all that Mr. Ramani has said.
Thank you once again. It's unfortunate that this has been reduced to a turf war and patients are suffering for this. This is not supposed to be. Like he said, we've had a long-standing relationship. Way back in 1920s, okay, when Dr. Noguchi and Dr. Young started working here on yellow fever, finding out the cause of yellow fever, laboratory physicians had started working here already. At the time, we didn't even have a training school for laboratory scientists. Through that time, We had Professor Eddington. We've had many of them, Professor Lane, Professor Posa, Professor Regu. Many of them have passed through the system. They were very instrumental in starting a laboratory science program because we are very certain that the laboratory is the science that directs the clinical practice. And we have never sought to stifle that growth, okay? This, therefore, is what is stifling the growth. In fact, laboratory practice is also becoming very automated. And sometimes people are worried that their numbers and the automation becomes an issue because you may lose your job. But this cooperation that we've had has worked very well until recently when some people started thinking that it was all about directorship. Let's face facts. Many of us are not going to be directors, and many of us will never be laboratory managers. There is no way our promotion should be based on a position of directorship. The position should be clear. Our promotion pathway is very clear. In the university, I get promoted to senior lecturer, I go to associate professor, and I go to full professor. It does not matter whether I become director, HOD, or whatever. That is not consequential. Okay, so we should find pathways that make sure that our population, the masses behind us, are also satisfied, and not the fact that one person wants to be director or one person wants to be manager. We have never wanted to superintend or supervise laboratory techs as managers. No, they have their own managers and they are capable of that job. Our issue has always been that let's work together. In the department of pathology, there are scientists and they work in the department of pathology, which is headed by a pathologist. And the technical aspect is managed by the laboratory scientists. It works well. So I do not see the issue with this arrangement and why my friend is complaining about it, and because of that, there's a sit-down strike, and we are talking strikes here. No.
But have the two of you had a discussion? You head the Society of Lab Physicians, and he heads the Ghana Association of Medical Laboratory Scientists. Have you spoken about this as heads of these two groupings or associations?
It would be good for us to have a discussion, but I think that there should be a mediator. That's why we're hoping that the Ministry of Health or other regulatory bodies would sit us together, because I don't think that people who throw two medical specialists out of a laboratory physically would want to see me. I probably will get beaten, and I'm not interested in getting beaten because people are not willing to listen to what pertains everywhere else. Ghana is making itself the only island in the world. Everywhere else in the world, there is practice that is clear for us to follow. All we need to do is to look at it and we follow it.
What is that practice, Dr. Akako? What is that practice you mentioned all over the world?
So if you look at the US, the two groups actually work in tandem. I'll use the US because that's one of the best centers. In fact, there's an association that holds the two bodies, okay? Now, like I said, there's the technical aspect of laboratory medicine, which is what is called laboratory science, and it's always managed or led by a technician, okay, a scientist. Then there is the department which holds that as a subset. That department typically has many other arms, including clinical. Sometimes, even for my department, we go to court. So putting all those together, in pathology, the department is headed by the laboratory physician. Now, they connect whatever happens in the laboratory setting to whatever happens in the clinical setting. It is the reason why he keeps mentioning that we have clinics. Yes, we even go for MDTs, multidisciplinary committee meetings, where there are many other doctors talking about patients who have and how we should move on with their treatment and all that. So the way it run is that medical laboratory science has always been managed by laboratory scientists, and they work in the departments that the clinical department, that's departments of hematology, clinical chemistry, microbiology, or anatomic pathology for that matter, okay? And there are regulations that make sure that these people collaborate and work together for the good of the patient, and not for their own personal interests.
Once again, I appreciate your time this morning. Dr. Kafi Akako chairs the Society of Lab Physicians. Hopefully, like you mentioned, we know the Ministry of Health and the Ministry of National Security together trying to solve this problem, especially at the Confanoche Teaching Hospital now. We hope that we won't get to that point, like we are told on Thursday, where lab scientists all over the country lay down their tools and will be able to resolve this matter swiftly.